name's Vaughn Caporasso. I'm a physician assistant in Glasgow, Kentucky at TJ Sampson ER. We're screened every day as soon as we walk in. We get one PPE mask. They are trying to conserve their supply of PPEs. And I think because they're doing that, they're only limiting one mask per person.
My name is David Wiesa. I'm a pulmonary critical care doctor in Queens. Never experienced anything like what I experienced over the last couple of months. We put a surgical mask over that N95 so we don't contaminate the front of it. So it makes it easier to reuse.
I'm Sarp Axel. I'm an OBGYN in New York City. My day-to-day is really sort of in the office, seeing pregnant women, taking care of them during their pregnancies, and then delivering them when it comes time to it. I have some colleagues in offices. They've been using the same mask for 2 months, and they're seeing patients. Rationing PPE is putting everyone at risk. It's putting patients at risk. It's putting providers at risk, and it's definitely not the ideal way that we should be taking care of people in our communities.
Think of like the worst day that I've had at work, and you've had that day at work for 2 months straight almost.
Some of the obstacles that stop us from being able to access and purchase the necessary equipment that we need really is the fact that healthcare workers and healthcare facilities and institutions are having to establish relationships with either middlemen or sources of supply that they previously have never dealt with.
People are looking for supplies all the time, and there's people posting, and you just don't know if it's legit. You don't know if it's, at cost. You just don't know what you're buying.
Even when the supply exists, we're seeing purchase agreements break down over payment terms, authentication issues, shipping timelines. When we helped set up a purchase of 100,000 masks for a major hospital group, the hospital had net 30-day payment terms, and today's suppliers just aren't accepting that.
Waiting for large hospitals and companies to change their policy in the middle of the pandemic is just unrealistic. We founded Miracle 2020 to facilitate PPE donations and purchase supply outright to distribute to healthcare workers as quickly as possible.
Donations to volunteer networks that are helping find solutions to the PPE supply chain gaps are incredibly important to ensuring that frontline workers are able to get the supply that they need that's authentic in a timely manner.
We need those masks. We need to protect ourselves to protect you.
Any amount of donation, any amount of support goes a very, very long way in making sure that hospital workers, non-hospital workers, healthcare workers of all walks and disciplines are able to get what they need to safely take care of their communities. So thank you so much.